Thank you for joining us. My name is Richard Carreon, and I'm the CEO of ImpediMed. It is my pleasure to speak with you today about the future of our connected digital health platform, SOZO. ImpediMed has been developing and selling bioimpedance spectroscopy devices for more than 2 decades. Our last generation of devices were introduced to the market more than 10 years ago. And while they filled an important need at the time, they were even considered groundbreaking then. In today's fast-changing world of medicine, they have slowly begun to fall behind. They were cumbersome to use. They required us to disrupt the flow of patients in busy practices. The exam room was necessary as the test had to be administered on a patient lying down. A highly trained person was required to prep the patient and place gel-backed electrodes on their body. Tests often took tens of minutes from the time you brought the patient into the exam room until you had your first actionable results. If you wanted to do fluid analysis, you had to use one device. And if you wanted to detail body composition information, you needed to use a different device. Now, we could have made small generational changes to our devices, but we knew in the end, this was not the best solution. So we decided to completely break from the past and start from a blank piece of paper. We literally designed SOZO from the ground up, keeping in mind patient flow, accuracy, data sharing, and clinician feedback. We even conducted extensive human factor testing that helped us with our overall design. Today, SOZO combines both the technology from our medical and scientific devices into a single connected platform that gives you detailed makeup of the human body in terms of fluid, fat, muscle, and bone. It's extremely easy to use. The software interface is intuitive and does not require more than a few minutes of training. An entire test takes less than 30 seconds. The results are displayed in graphical formats to ensure ease of interpretation, often with clear reference ranges so the trends are easily understood, and if indicated, intervention can be considered. All patient data is encrypted and stored in a secure cloud. No patient data is stored on the device. During our heart failure studies, it became apparent we had the ability to grade the quality of each patient test. Today's software quickly and accurately analyzes each patient test and assigns it into one of 3 categories: high, medium, or low quality. If the test is of high quality, the patient results are automatically displayed, and a vast majority of tests fall into this category. If the tests are of medium quality, you'll be showing the data and ask if you want to accept it or re-administer the test. If in the off chance the test is of low quality, you are required to re-administer the test. This new feature ensures the highest accuracy of our patient information. Now, it's been our vision since we began developing SOZO to build a platform that provides a wealth of information to clinicians treating patients with cancer. Look at the Venn diagram on the right-hand side of the slide. Of all the cancer patients, the outputs provided by SOZO touch a vast majority of cancer patients, from lymphedema to heart failure, protein-calorie malnutrition, hydration, nutrition. As I said earlier, we believe by utilizing the full breadth of our technology, we can help clinicians improve the outcomes and quality of life for our cancer patients. I mentioned earlier, SOZO was a connected digital health platform. This allows institutions to have their patients take readings from anywhere in their system and see the data on any authorized web-based browser. Today, some of our largest partners have more than 20 devices spread across their campuses. Their goal is to ensure they obtain a SOZO reading on each cancer patient every time they come in for treatment. The goal is to make it easy on the patient by not having them come to one central location for testing. Our back office software provides a powerful grouping, trending, and data export features. The possibilities here are endless, and they allow customization of your data and easy search and sort functionality. All these new features have been added because of feedback from our SOZO users. We care deeply about the feedback we receive from them, and we strive to continually improve our user experience and output based on their request. We see this as one of the main reasons our software continues to evolve in meaningful ways that we had never originally even imagined. Each evolution has made the information we provide clinicians more medically meaningful and actionable. Now, we could not be more excited about the future of our technology, and together, we believe we can improve these outcomes for millions of patients. Let me show you the journey we've started to undertake. We are now developing and expanding our indications for use. We originally had unilateral lymphedema for women only just a few short years ago. Now we've added bilateral lymphedema, and our label now allows for the testing of men for this horrible chronic disease as well. We've also added protein-calorie malnutrition and heart failure. And now we're currently working with the Food and Drug Administration on bone mineral content and renal failure. As we gather more data from across the globe, we will continue to add indications for use. What I've shared with you this afternoon is what we currently have in our pipeline. We will continue to push the boundaries on new hardware, software, and the use of artificial intelligence. Each of these will drive advancements in our data analytics, and they will drive advanced reporting features that will allow for faster, easier, and more medically meaningful information for clinicians. Our software also incorporates APIs for all data sets to ensure we remain compatible with major electronic healthcare systems. These advances are leading us to move to a more holistic approach to our reporting of patient information. We see a day not in the too distant future where we report on the overall health of a patient. For instance, let's take an example of a woman undergoing breast cancer treatment. Instead of just testing her for the development of subclinical lymphedema, as generally happens today, that same SOZO test will help the clinician manage her throughout her treatment and survivorship journey. As she moves through her treatment and follow-ups, our testing will provide a single report on the status of her lymphedema monitoring, hydration levels, bone health, as well as indications if she's developing fluid overload as a precursor to heart failure. As healthcare systems test more patients, we see them using our data, artificial intelligence, and advanced reporting features to manage entire patient populations. Imagine when we move to holistically reporting on individual patients' health. What this means for population health will be enormous. We would know information that would allow us to improve overall outcomes, mitigate risks, and reduce healthcare costs. We believe we have a bright future ahead of us, and we appreciate the time you've taken to hear just one small portion of where we're at in our journey. Thank you.